We good, Mike?
Good to go.
Great. So good afternoon, everyone. I'm joined here today on the traditional territory of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations, by Dr. Henry and Minister Dix. And before we begin our discussion about the events that will proceed from this point forward, I just want to take a moment and speak to the senseless violence that took place in the North Shore over the weekend, and actually the end of last week. I cannot express my sorrow for the people involved and affected by this action. And I want to say to all of those who stepped up to help and to be part of a solution, thank you for being good citizens, to helping those who needed help, needed a shoulder, needed someone to talk to. And of course, to the families affected, my deepest sympathies at this time. And I want to start by saying that since the pandemic began, Dr. Henry, Minister Dix, and I have been focused on one thing, and that is keeping British Columbians safe. And we've been making great progress in British Columbia, and oftentimes I've taken to this podium without Dr. Henry and Minister Dix as they conducted their regular engagement with British Columbians while I took care of other issues that required attention as we came through the pandemic. But the past couple of weeks have put significant challenges in front of all of us, and I wanted to be here with them today to talk about those two primary issues. The first, of course, is the increase in case counts over the past 10 days or so. Dr. Henry and Minister Dix will get into the details of that, but during the past week, case counts have risen unacceptably high, in fact, higher today than at the worst point of the second wave between November and January of this year. The percentages of tests coming back positive has gone up by 50% in some areas, and the number of variants in British Columbia has also increased. Again, Dr. Henry will talk about the science and the details of that. I wanted to be here to say to British Columbians that we have made such great progress together, focusing on our collective well-being, individual actions to protect the greater good. And we've come a great distance, but we cannot blow it now. We're so close to the end. Our vaccine program is ahead of schedule. We have a whole range of positive outcomes from the work that we have all been doing, but we're not through. We have weeks and weeks to go, and we need to redouble our efforts to focus on individual responsibility for the greater good. Now, I know that people that tune in regularly to see Dr. Henry and Minister Dix are following the rules. They are paying attention to the details and focusing on making sure that they do their part to get British Columbia through this. The cohort from 20 to 39 are not paying as much attention to these broadcasts and, quite frankly, are putting the rest of us in a challenging situation. I'm appealing to young people to curtail your social activity. The directions will be quite clear from Dr. Henry, but my appeal to you is do not blow this for the rest of us. Do not blow this for your parents and your neighbors and others who have been working really, really hard, making significant sacrifices so we can get good outcomes for everybody. The second problem that's arisen is one, again, that Dr. Henry will touch upon in more detail than I, but that's about the eligibility for the Astrazeneca vaccine. We've had new advice. Dr. Henry's been working, of course, tirelessly with her colleagues across the country and with the National Advisory Committee on Immunization. We want to make sure when there is an indication that we need to be cautious that we do just that. Our objective, as I said from the beginning, is to keep people safe. So Dr. Henry will talk to you a bit about the Astrazeneca vaccine and how that will impact our progress going forward. But you also need to know that we had not calculated AstraZeneca into any of our thinking with respect to age cohorts. The Pfizer vaccine and the Moderna vaccine are coming in large amounts in the next number of weeks, and we are very confident that we'll continue with our exercise to make sure that age cohorts, the seniors that are so much at risk, get the vaccines that they want. And I know from my phone calls over the weekend to friends and loved ones and random calls to the many hundreds of people I talk to in a week, those that are getting a date with a vaccine, those who get a vaccine, is transforming how they look at their daily activities, giving hope for the future. And although I try to be hopeful every time I come to this microphone, I am here with a call to caution. We have lots to be hopeful about in the weeks and months ahead, but not if we don't follow the guidelines that Dr. Henry is going to lay out at this moment. Thanks very much for listening to me, and I'll pass it on to Dr. Henry to give you an update on orders, cases, and AstraZeneca.
Thank you very much, and good afternoon. So it is a most challenging time for us right now, and today is going to be a day for us to reflect and to make some change. First off, we have a number of updates around the cases. Since Friday to Saturday, we had 936 new cases diagnosed in British Columbia. Saturday to Sunday, an additional 805 new cases. And in the last 24 hours, 774. That's a total of 2,518 new cases of COVID-19 diagnosed over the weekend, bringing our total to 98,165 people in British Columbia. That includes 816 people in the Vancouver Coastal Health Authority, 1,280 people in the Fraser Health Region, 142 people here on Vancouver Island, 156 people in Interior Health, 121 in the Northern Health Region, and 3 people who usually reside outside of Canada. We now have 299 people in hospital across the province, 79 of whom are in critical care or ICU. And sadly, again this weekend, we've had 6 people who have died from COVID-19 in British Columbia, bringing the total number of people who've died from COVID-19 to 1,455. Our condolences and our thoughts go to the families and the communities who are mourning their loss. We have 3 new outbreaks as well in British Columbia at the Abbotsford Regional Hospital, Prince Rupert Regional Hospital, and Long Lake Chateau. The outbreak, however, at the Surrey Memorial Hospital has now been declared over. So we do have 4 active outbreaks in long-term care, assisted living or independent living, and 9 now in acute care facilities across the province. Also of concern, as you've heard, we've had 329 new confirmed COVID-19 cases that have been identified as variants of concern. And that brings that number up to 2,233 cases. Of these, 413 are active now. That indicates the proportion of these that are now affecting people right now. And most of these are the B117, the UK variant, 1,915. And of course, we know that this is a variant that is much more transmissible, and we're getting more and more evidence leads to more serious infections in younger people. The number of the South African variant, the B1351, remains fairly low at 48, but also of concern, we've seen an increase in the P1, or the variant that's associated with Brazil, to now 270 cases. And that is also a concern, because we know this variant not only is more transmissible to people, but also has been shown in some parts of the world to be less amenable to the vaccine. So it is important for us to take measures now to stop the transmission of these important variants in our communities as our vaccination program is ramping up. We are concerned that these are driving much of our current transmission, and I'll speak to that in a minute. To date, and I know Minister Dix will talk a bit more about that, we've delivered 699,092 doses of all 3 of our COVID-19 vaccines across the province. Of those, 87,289 are second doses, but we are making good progress with getting the important protection from the first dose into more and more people across British Columbia. As part of our vaccination program, we have a very robust pharmacovigilance, or vaccine safety system here in British Columbia, and you've heard me talk about this many times. Every single dose that goes into an arm in British Columbia is recorded so that we know what vaccine, what lot number, and if there's been any effects from that vaccine. So far, we have identified 523 adverse effects following immunization, or APHIs as we call them, the majority of which are allergic or anaphylactic reactions. However, we have been monitoring not only what is going on in British Columbia, but working closely with our colleagues across the country, with Health Canada, the regulator, and the Public Health Agency, to make sure that we understand the safety of vaccines across the country And the regulator and Health Canada are involved internationally to understand safety of vaccines around the world. Over this past week, a signal was detected in younger people in Europe using the Astrazeneca vaccine. While the instances are rare, this is a very rare condition with tens of millions of doses of this vaccine being used. We are taking the precaution of suspending the use of this vaccine for people who are under age 55 for the next few days. Health Canada has issued what they call terms and conditions to obtain more information from AstraZeneca about the risk-benefit profile and what this might mean to people here in British Columbia and in Canada. NACI, the National Advisory Committee on Immunization, has again, over the weekend, we've had many discussions, and today, because we have alternatives for people under the age of 55 in this country, we have met with our Council of Chief Medical Officers of Health on this issue several times in the last few days and have agreed to take this action together until we get that assessment and understand what the risk may be. We anticipate that we will have more information in the next 2 to 3 days. Health Canada is working closely with the European medicine agencies and the UK to understand what this means in those countries and if there are implications for people here in British Columbia. This is our safety system working across the world and in Canada. It means that we are taking immediate action when we see a signal to protect health, to make sure that we understand this and that we use this information to appropriately use the vaccines that we have. This is a rare instance of what's called vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT for short. There's been less than 30 cases identified around the world, primarily in Europe, but it is a serious condition and could lead to serious outcomes. So we are acting decisively, unified across this country to pause the use of this vaccine in people under age 25 right now until we get this additional information. We have other vaccine options and we will be using them, as we've said. Basically, right now, if you have received the AstraZeneca vaccine and it's more than 20 days since you've received it, there is no concerns. If you have received the AstraZeneca vaccine and you develop symptoms that are concerning, such as headaches or swelling, and we have a list of those symptoms on the BC CDC website, you can seek medical attention. What we do know is that this is very rare and it is unlikely we will see any cases here in British Columbia or in Canada, but it is also a condition that we have a test for and there's treatment. So we will be updating our information about that and it'll be available to everybody today. We have also passed information on from Health Canada and from the regulators to clinicians across the country so that we know what to look for in these, if one of these rare instances arises in Canada. We will know much more about this in the coming days and be able to update our programs and our advice to people as we attain more information about how this works. The other thing that is important, we have time to understand how this will affect second doses in people who have received the AstraZeneca vaccine. It is very likely that second doses will be available, but we have time between now and 3 to 4 months to understand the implications of this. I also want to make it very clear, this vaccine is an important vaccine globally and in Canada as part of our immunization programs, and we know from the studies that have been done that it is safe. We now are looking at our safety signals and taking action until we have more information, and we'll be providing that as it comes. So while the COVID-19 virus continues to challenge us, our goal throughout the pandemic has been to find here in BC our balance. We want to protect those who are most vulnerable and keep as much as is safe to be open in our communities. As a result of these recent increases and what we've seen about the increase in variants of concern, our balance in BC is now off. And this is a very challenging time. In the last 6 days, we've seen the start of exponential growth in new cases. We've seen more hospitalizations and more people requiring critical care. And the strain on our acute care systems is ramping up. We do not yet have enough people protected with our vaccines to keep our loved ones and our communities safe. A circuit breaker is now required to break the chains of transmission in our province and allow us to safely move forward through this next phase. Gathering indoors is what is the greatest risk to all of us right now. As a result, for the next 3 weeks, from midnight tonight through to April 19th, I am putting a number of amendments in place. First, indoor dining at all food and liquor serving premises is paused. These locations may remain open for full meal service on patios or for takeout or delivery only. Those who only serve snacks or appetizers must close. Additionally, indoor adult group fitness activities of any kind at gyms, fitness centers, or studios are also paused. Activities in these locations are restricted to individual or one-on-one activities only. Contact tracing has shown us that these settings amplify the spread, and as a result, activities indoors in these locations need to be on hold for now. As the Premier mentioned, we are seeing transmission through social interactions, through social networks, but they are being amplified and transmitted through some of these settings in our communities that have remained open, as much as we have tried to ensure that COVID safety plans are in place and people are following them. If you're unsure if this applies to you, then I'm asking you to stop what you are doing for the next 3 weeks so that we can make progress with our immunization program. The previously announced order variants for limited indoor worship services that we have worked very carefully with our faith leaders across the province will now need to be suspended. It is with a heavy heart that I have to announce this. This is something that we have worked carefully with faith leaders of all faiths, and it is something that I know was important for people. But I cannot, in all conscience, with the increased numbers of cases that we're having and the risk that we see from indoor services, allow these types of activities to happen right now. Our outdoor worship service under the current variants may continue because we know that it is much safer to have these types of activities outdoors. We've also seen transmission directly connected in travel between communities and remind everybody, now more than ever, travel is limited to essential travel for work or medical reasons only. We need to pay attention to this now. We have seen increasing cases related to travel over this past few weeks. We know that people have taken advantage of the weather and the March break to go places with their family. And what that has meant is that we've seen a rapid rise of cases of people have returned to their home communities. And this is important for us to pay attention to now. Additionally, we've seen increasing cases again in the Whistler-Blackcomb area, despite testing and contact tracing and much work that Vancouver Coastal and the community have been doing together to try and support people to isolate and to prevent transmission, and the immunization program that we've started in the worker accommodation in Whistler. Unfortunately, this has not been enough, and we're starting to see cases increase again in that community, and particularly in the past week with the more worrisome cluster of the P1 Brazil variant of concern. We've also seen transmission from travel to and from other communities across BC from the Whistler area. As part of this, we will be closing the Whistler Blackcomb Ski Resort for the same period between now and April 19th. It is critical right now that if you or anyone in your family develops any sign of illness, that you, especially children returning from spring break, and if you have traveled, you must stay home from work or school. Arrange to get tested immediately. We also ask everybody right now to pay attention to how you can work from home, whether this is businesses, unless you have to be in the workplaces. We're asking everybody to take that measure again, to work primarily from home as much as possible. Over the past few weeks, a great deal of work has been put into supporting a number of our school districts. And prior to the March break, we were focusing on the Surrey School District, recognizing that the cases in the community in Surrey have been at the highest levels of any community in the province. We know this has been an ongoing challenge, and that the Surrey School District, those educators and everybody who in our school system have working very hard to ensure that we can support safe in-classroom learning that is so important for the physical, emotional, and mental growth of our children and our communities. As part of the suite of activities and changes and upgrades to the safety plans that were being made in the district, the medical health officer, with my advice, has issued an order to ensure increased mask wearing in schools in the Surrey district. What we have seen with the increasing concern across the province and the increasing concern and transmission events that we're seeing now, and understanding the disruption that exposure events in schools can have, we are now going to be we're going to be updating our K-12 public health guidance to support mask wearing for all students down to grade 4 in schools across the province. We know that this needs to be done in a way that supports children to wear masks at all times when they're in the school setting, and to make sure that we are doing that in a way that is positive and supportive for children. It is one of the many measures that can be used to help prevent transmission in our school setting. Non-essential activities need to be limited to outside only, and with the same group of people. As we've seen, there's been a dramatic increase in transmission between young people around the province, and I know that this has been a most challenging year for young people. It's people who've had challenges with job prospects, with their school being remote, with not having those important connections and celebrations of transitions that we want to have and need to have in our communities. But right now, we are asking you to be part of the solution for this next few weeks, so that we can protect more people in our communities with vaccination, and we can bend that curve. Right now, we have said that we can have groups gathering outside with no more than 10 close contacts in total. That does not mean one group of people today and a different group tomorrow. It also means that if you have a work or school group that you need to have contact with, or a cohort, you may need to limit that even further. Social connection is critical for us. I know that. And I know in particular that young people feel that strain of being apart from friends. So I'm asking for your help for this next few weeks. Take an extra effort to be aware, to choose your 10 friends or family members and stick with them for this next few weeks. And if you are gathering outside, even if it starts to rain or snow, as it has, stay outside when you're with your friends. Putting new restrictions and orders in place is always a difficult decision. And I can say that we have been agonizing over this across the province with my public health colleagues for the last number of days. But we know more now, and we know that there are settings that we can we can safely have activities, and focusing on those safe activities, particularly outdoors with small numbers of people, is what will get us through. At this time, it is a step back from where we want to be and from where we need to be. But when spikes and surges become a sustained trend, we need to take these steps to continue to protect those we love and those we don't know. We need a circuit breaker to stop this virus now. We all have a choice. We have a choice to stay safe, to put our loved ones, our friends, and ourselves at risk, or to protect them. Making exceptions or bending the rules gives this virus the edge it needs and makes it that much harder to get to those brighter days ahead that our immunization programs and our efforts together promise. Let's all of us stay outside, stay apart, be together by staying apart, and stay with our same group of close contacts for the next few weeks. I'm asking you to remember that we can get through this, that this is another one of those challenging times. You know, the miles are hardest when they're closest to the finish, but there is a finish in sight now, and we know what we need to do to get there. And as always, I'm asking you to take this to heart, to continue to be kind to each other, to stay calm even in the face of this setback, and to be safe. Thank you.
Thank you very much, Dr. Henry, and thank you, Premier Horgan, for your words and your leadership throughout the COVID-19 pandemic. I want to start by saying, on behalf of all of us, on behalf of the Premier, on behalf of myself, the government, I think the people of BC, I want to pass on our condolences, our thoughts to the 6 people who passed away this weekend related to COVID-19 in British Columbia, 3 from Friday to Saturday, 1 from Saturday to Sunday, 2 from Sunday to Monday. It is, and especially as we have passed a year of significant public health orders, a very difficult time to grieve, and we are with you, all of you, in this moment. As Dr. Henry has said, and as the Premier has said, throughout this pandemic we learn, we adapt, we keep moving, and this is one of those days. Over the last number of weeks, in the period from, if we look at Friday 7-day averages, in terms of test positivity, we were consistently showing every Friday in the range of 6.5, 6.6, 6.4, 6.7, too high, of course, but consistent levels of test positivity. Over the last 7 days leading to this Friday, that number went to 9 today. That number is 9.68% test positivity, which means very significant growth in the last week. And this requires a circuit breaker. It requires action. And Dr. Henry has described that action in terms of public health orders that must take place. I want to remind everyone, though, that the existing measures, which are in many respects even more powerful, even stronger, those measures that say that you can only socialize with those in your household, those extraordinary measures are still in place and must continue to be in place. I want to acknowledge, too, that our immunization campaign has been doing very well. I want to acknowledge all of the people involved in it. 699,092 people, shots have been delivered into people's arms. 611,803 have been first doses. In the last, over the weekend, that was 61,236 more doses. And again, at the end of yesterday, and surely at the end of today, we will be looking forward to the new Pfizer that we are receiving this week, the 160,000 doses we are to receive this week, because we used the 160,000 doses essentially we needed Monday, and we got Monday and Tuesday and Wednesday of last week, which is exceptional. It's what all of us want, which is when we get vaccine, to get it into the people's arms, and in particular the arms of those most vulnerable to COVID-19 right away, and that's exactly what we've been doing. I just want to put that in context, so that, because I know many of you are concerned about our elders, that 44,068 people over 90 in BC, of which there are about 50,000, have already been immunized with their first dose. 58,900 people between 85 and 89, 75,247 people between 80 and 84, over 65, 286,000, and 23 people have received their first doses of COVID-19. Today, we're saying that everyone who's age 73 or born in 1948 or before is able to phone and make an appointment, as are those who are clinically vulnerable and have received letters from their health authority, are able to dial in and book appointments today. And we encourage you, when you are contacted, when it's your turn, to step forward and be vaccinated, because every time someone is vaccinated, it makes everyone else safer. As Dr. Henry has said, our Astrazeneca campaign, the effort to immunize people with Astrazeneca, has been briefly suspended, except for people 55 and over. And that is because our public health officials put safety first. And whenever there's a safety signal, they respond to it. That's the confidence you can have when you get a vaccine in Canada and when you get a vaccine in British Columbia. And that's the step that's been taken today. So I just want to say finally, I guess, that we know that a few days or a week can make a difference in a pandemic. And we know also that 14.2% of the 4.3 million eligible British Columbians have had their first dose of vaccine. But it's also true is that when our numbers have continued to increase, are too high, and are still going in the wrong direction, that's what's happening now. And whether we call it a surge or a resurgence or a third wave, what matters more is that for every single one of us, for all of us, it is a call to action, an immediate and urgent call to action to stop the spread. Thinking that we're just spectators to a showdown between the virus and the vaccine misses the strongest part of our fight. That is us. Since news of vaccine emerged, it was always going to be our every effort to stop the spread, our best and greatest effort to stop the spread that would give vaccines their best chance to do the greatest good. So that's where we are at right now. It's us, all of us, and vaccines against COVID-19. The vaccines are effective, but they and the extraordinary people delivering our vaccine effort across British Columbia cannot wage this battle alone. The vaccine needs us, and only our efforts will give the vaccines that we have every advantage against COVID-19. Once again, we need to, all of us, step up, dig deep, and dig in. Right now, it's us and the vaccines against COVID-19. Happy to take your questions, and I'll turn it back to the Premier.
Thank you, Minister. As a reminder to everybody on the phone line, please press *1 to enter the queue. You're limited to one question and one follow-up only. First question today is from Katie DeRosa, Vancouver Sun.
Hi, Dr. Henry. I'm just wondering, with the decision to still allow the outdoor social gatherings, are you confident that that is not a source of transmission, and that it's mostly the indoor social gatherings? And can you give some examples, even for the restaurant industry, for example? Have we seen a high number of transmissions, and can you give us some examples of that?
Sure. So, we need to find that balance, and this is something we've been trying to do, and there are some areas where we are seeing transmission events. They're not when we're outdoors, when we're maintaining our distance, when we're being safe. And we've said that from the very beginning. We know that this virus, as we've learned, doesn't transmit as well when we're outside. It doesn't last as well outside, and we can protect each other by having that distance between us outside. So those are the things we need to focus on now, how we do that and do that safely, whether it's going for a picnic in the park, if we are out in our own backyard, making sure that we're not crowding a whole bunch of people under a small tent. We've seen some of those things. Those are not safe activities. Safe activities are when we're spread out, we're enjoying each other's company, but from that distance, and having that same small group of people, so we're not exposing many others. And what we are seeing, and yes, it's not all restaurants by any means. Most of them are doing a really good job, but I am hearing more and more, and we've had the support of of many in the Restaurant and Beverage Association, the understanding in the last few weeks in particular that there's a lot of frustration, especially among younger people, about the restrictions and the restrictions on social connections. And with March break and universities being out of session for a while, we're seeing that lead to augmentation of transmission through places like restaurants and bars and pubs. And it's unfortunate, but right now that indoor setting is where we're seeing it most transmission happening. So, we've talked about what happened with the pub that had the event in Fraser Health, but we have many such examples. We did some targeted work-safe inspections in Whistler a couple of weeks ago. We found that it was very challenging for staff to manage groups of people later in the evening, and that was what was leading to transmission. Often people live together in common crowded housing, so some of the staff accommodations in Whistler, for example. But we're seeing that in places all around the province and mostly in the urban areas. So now's the time to give people a break, to step back from those indoor environments where we see this risk being greatest.
Katie, do you have a follow-up?
Yes, and on the faith gatherings, looking back, transmission was going up last week, even as this was announced on Thursday. So was this as a result of pressure from faith leaders, given the religious holidays coming up? And, do you regret making that decision on Thursday? And do you think people will be, in the religious community, will be upset that they're now sort of having to go back on something they thought they were going to be able to celebrate?
I have, it's been a process with the faith leaders, and thanks to Dr. Robert Daum, who's been facilitating that process. We've been talking over many, many weeks. So this was discussions that we had over many weeks, and part of the caveats of that variance always were it depended on our epidemiologic situation. And I hope, and I've sent a letter through Rabbi Daum to the leaders that we've talked to about this. This was always part of our discussions as a potential. I was very hopeful, even as late as last week, that we would be able to get through this next few weeks, keeping where we were. And it really has been the dramatic increase in the last 5 to 6 days that has shown us we're on a trajectory rather than where we have been, which is grumbling along at a rate that was quite high, which worried me, because when you have 500 cases a day, the probability of it going up exponentially is much higher. So it really is a race in time, if we will, between being able to keep cases low enough and our vaccine protecting more and more people. But it takes time for the vaccine to have that optimal protection too. So we're just in a very difficult position. And we're not alone. We're seeing this across the country. We're seeing this in many places around the world. And I know some of the key faith leaders for the Jewish faith, for the Catholic faith, have also come out and said that, unfortunately, given this virus and what is happening in Canada, in BC, and in many places around the world, that some of these important holidays are going to be different again this year. And we can only get through them this year and support each other through them this year so that we can have them with those people we love next year.
Next question is from Rob Shaw, Check News.
Oh, hi. Premier, I'm just wondering if there's any aid packages from the province coming for the restaurant sector, the people who are potentially going to lose their jobs here, some of the gym workers and others. Is the province considering anything, picking up part of their salaries, anything like that?
Yes, we are. And this morning, Dr. Henry, Minister Callon, Minister Baines, Minister Mark met with our table of business leaders in hospitality and in tourism and other sectors to advise them of the orders that were coming in. And obviously, there was disappointment around that table, but an understanding that the circumstances require the actions that we're taking. As a result, we have an obligation in government to be where we have been from the beginning, and that is at the side of people, businesses, and communities. And Minister Callon's gone away and is working with his staff and my deputy to put in place any additions to the programs that are already in place, as well as looking at how we can bridge these next 3 weeks, particularly for the hospitality sector, which was gearing up as we saw the better weather in the south of British Columbia. But we need to break the cycle. We need to ensure that everyone's in this together, and the government will be there for those businesses who are affected by this.
Rob, do you have a follow-up?
I'm just wondering if you could flesh it out in any more detail. If someone who is watching their shifts at a restaurant disappear as of tomorrow, potentially, when would they see whatever it is that you're working on, and how quickly will that help them pay their rent or whatever bills are on their plate?
Well, we've already put in place, as you know, restrictions about evictions in British Columbia. They remain in force. We have a range of other programs that are there for people to access. The COVID benefit, some almost $2 billion has flowed out the door to British Columbians to meet their needs. And we'll continue to work developing new programs as required. The challenge is, as you know, though, Rob, is that governments usually take a lot of time to put these types of initiatives in place. And we've been moving with significant speed to put in place programs to fill gaps at the federal level, to assist municipal partners with respect to other initiatives like transit and providing services to people. We're going to keep doing that. I don't want to get into specifics about the next 3 weeks, other than to say that the minister's on it, the government's on it, and we'll have more to say once the programs have been developed.
Next question is from Binder Sudgeon, CTV.
There. I'm just wondering if you can talk a little bit more about places that have had test positivity rates of more than 50%. Is it just Whistler, other parts in the province as well? And just if you can kind of paint a picture of what that's like right now in the province.
Yeah, so we've been talking that the epicenter of the pandemic continues to be the most populous areas of the province, particularly in the Lower Mainland. And so it's not a test positivity of 50%, it's been a 50% increase in the test positivity. And, you know, on a day-to-day basis, that one single day doesn't make necessarily a difference, and same with the numbers, but we look at the 7-day rolling average as a way of smoothing out what's happening over time. And as you know, we've been seeing a steady increase over weeks. But in the last week, what we've seen is that start to inflect upwards, both in the numbers of cases, the 7-day rolling average number of cases, but also in the percent of those tested that are positive over time. So we've gone on average in the province from about 5% to closer to almost 10%, but it is much higher in some parts of the province than others. The city of Surrey is one area, or the area around Surrey is one area where we've had consistently high transmission rates in the community, and that's reflected in outbreaks in workplaces, it's reflected in exposure events in schools there, and the percent positivity has crept up and then dramatically increased. We've seen very high rates in the north, reflecting again the fact that the number of people tested is smaller, but the chance of them being positive is much higher, and in many communities across the north. What is worrisome, and we did have many discussions over this weekend about whether we needed to just apply this to the Lower Mainland, but what we saw in October is repeating itself now. We start to see a slow increase and then a rapid takeoff, and it starts where the population is greatest, where the numbers of cases are greatest, but it very rapidly spreads, and we've started to see an increase on Vancouver Island over this weekend and in the interior. The north has remained very high, and we've been targeting different communities in the north. So Whistler is particularly concerning. As you know, we had an outbreak there, started over the winter holidays, Christmas season. We seem to come under control, but we've had waxing and waning, and in the last week it started to take off again. And we've seen that people who have traveled to Whistler and gone home, both to the Lower Mainland, to parts of the interior, and here on Vancouver Island, we're starting to see cases pop up here that are related. So it really is looking at it as a whole and recognizing that we are very connected as a province, despite our geography, that people move, and this virus moves with people. So we need to take these measures across the board to be able to keep things down so that we don't put our hospital system at risk, and we're able to focus on those important services in our communities, our workplaces, and keeping schools open.
Follow-up, Binder?
Yeah, I'm just wondering also with regards to schools, we saw some warnings that some school districts can expect a large increase in the number of cases in the coming weeks. We know that hotspots like Surrey, the teachers are getting, we're getting Astrazeneca up until now. So I'm just wondering what you are telling people to expect in schools over the next couple of weeks, and for teachers who are in the vaccine program, expecting perhaps their second dose in a couple of weeks, what they should be expecting as well, and if it has ramifications about whether you're going to, grocery store workers, maybe you'll get to them a little bit later than you anticipated because of this change with AstraZeneca.
Yeah, no, really good questions. I will say this is a temporary pause, I expect, and until we learn more. And so we will be coming up with our recommendations about how we're going to use. We have very little of the Covishield AstraZeneca left in the province. So we'll be making a decision on how to use that in the next few days. And we are expecting some more of the AstraZeneca from the U.S. to be available very soon. So we will be making decisions. It is possible that we may need to use that vaccine in people where we know this rare event is not likely to happen, but those are things that we'll be working out in the next few days in consultation with our colleagues across the country and internationally as we know more. Yes, we've been focusing on Surrey for the very reasons that I mentioned, that we know there's a lot of transmission in the community, and that reflects in exposures in schools. And although we've had very little transmission in those schools, even in Surrey, we know how disruptive those exposure events can be. Right now, what we're seeing is that since school has been out, we've seen increase in cases across the board. And this tells us that people are having social connections, are traveling, and we're seeing increased transmission. So that, understandably, will reflect in schools across the board as well. So we do think now, if people have traveled over this last few weeks especially, or if there's anybody in the family feeling unwell, that you should get tested and not go to school so that we avoid those potential exposure events that can be so disruptive. And that's an important message right now and always, as we are protecting more people. And we know that it's going to be more important in areas where more transmission is happening. So we are asking people everywhere those health checks are really important now. Pay attention to those and don't go into work, don't go into school if you're not feeling well.
Richard Zisman, Global News.
Dr. Henry, I'd like to ask about first travel, and this may be for Premier Horgan as well. Is this the same advice as we've heard all along, or are there specific measures in place to ensure that people do not travel from health authority to health authority? And is there part of this order that requires people who did travel that aren't feeling well to get tested? I'm a little bit unclear in the language there.
Yeah, no, it is the same as what we've been saying, but we are reinforcing it now. I know, I said it myself, that over the Easter break, if families wanted to go in a self-contained way to communities, we're now seeing the impact of that. And so I am appealing to everybody, you should not travel unless it's necessary for work, for medical reasons. We need to hunker down for this next few weeks. Stay close to home. It is movement of people that moves the virus, and we've seen that happen. It is sometimes travel from other provinces, and we will be signaling very clearly that that's not acceptable anymore. We don't want you here right now, and we need to stay close to home as well.
Richard, do you have a follow-up? Richard, are you there?
On the guidance around fitness classes, is there an age restriction on this? Does this include kids' dance classes or hockey practices or anything related to kids? And what are the restrictions around what people can do in a gym or a workout space that is different from before?
Yeah, so what we are talking about is adult fitness classes in gyms, fitness studios, dance studios. So it is not the youth programs that we have in place with very strict restrictions, and I know that's a challenge for youth as well. They want to go out and play games and have games with others. But we need to continue with just the local team practices right now. We had been talking about increasing youth sports, particularly outdoor sports, later in April, and I still think we can do that. If we pay attention to what we need to do now to allow us to get the immunization program ramped up safely around the province, then we are still on track to be able to do more, particularly outdoor sports later in the fall or later in the spring. But right now, this applies to adults. So what you can do is one-on-one training with a trainer or individual fitness in a gym, but it needs to be with the adequate COVID safety plans in place. So that means small numbers of people, space around you, but none of the group activities that were happening. Group activities can still happen safely outdoors.
Next question is from Lisa Houston, News 1130.
But it needs to be.
Lisa?
Hi there. Sorry. Hi there. Can you hear me? Sorry, I'm trying to do 5 things at once. I'm wondering, Dr. Henry, can you go back to talking about people who have traveled around the province and testing they should do? Is it just people who have traveled to Whistler who should go get tested? I just want to be very clear on what you're asking of people.
I'm asking anybody who's feeling unwell with symptoms of COVID to get tested and to stay away from others. It is absolutely, we've seen spread of the virus from people who travel to Whistler, but there's also, as we know, a lot of transmission in communities around the province right now. So the people traveling to and from the Lower Mainland, to many parts of Vancouver Island. In the north, there are many communities where there's been spread of the virus through travel across the north. So we need to pay attention to staying close to home right now, unless it's absolutely necessary.
Lisa, do you have a follow-up?
Regarding the variants, are there certain areas more than others that people need to be more concerned? Will we get a specific breakdown of exactly where P1 has been? And I'm wondering the growth of that, how concerning that is to you, because it's certainly getting a lot of headlines.
Yeah, I noticed one of my colleagues published something about the detecting of it in St. Paul's. And yes, the laboratory at St. Paul's is one of the labs that works as part of our public health lab network. The initial cluster of the P1 variant, this one associated with Brazil, was in Vancouver Coastal, and that was investigated and contained, and we were fairly confident about that, the good work that my colleagues in public health are doing around case management and contact tracing and determining, circumscribing around that cluster. What we've now seen is there's been a couple of clusters in the interior. Again, public health is working very aggressively to make sure that we've found every contact and are able to contain that. But we've also seen this cluster, a cluster of cases related to the P1 variant in Whistler, and that is concerning to us. It's again, Vancouver Coastal Health is working very closely with the community to make sure that we can find who's in contact with whom, and that work is ongoing. But it is absolutely concerning. Any rise in something that makes the virus more transmissible puts us all at greater risk. And we've seen the increase in the B117 primarily, and that's been across the board, but has started, as we've seen through this whole pandemic, it starts where the most population is. So it started in the Fraser Health and Vancouver Coastal regions. We're now seeing some spread of it in other parts of the province. But it reflects travel patterns as well. And we are seeing it replace the other strains that we had of COVID. And this is one of the reasons why we've put in these indoor restrictions right now. The increased transmissibility of these variants means that any lapse in our protection measures in an indoor setting makes it very risky. What we're seeing when we follow up with cases that normally in a household, for example, transmission would happen to 10% of the people in the household. Now we're finding with some of these variants, despite people trying to stay away from others, that it spread that much more easily. So all of the measures that we need to take are that much more important.
We have time for one more question this afternoon. That comes from Tanya Fletcher, CBC.
Yeah, Premier, on March 17th, you said BC was on the right track. Given what we know now, is that positive messaging, or as some have called it in the recent weeks, mixed messaging? Is that a mistake? Are there any regrets there, especially when many experts warned this is where we were headed? And maybe this is for Dr. Henry. If we are doing a circuit breaker, as you call it, why not shut down more things? Some are asking, like retail and personal care services too.
Well, firstly, I've been following the advice and guidance of Dr. Henry and Minister Dix for the past 12 months. I have no reason to step away from that. And over the past number of weeks, as we saw a renewal of the federal government's commitment to landing more vaccination materials here in British Columbia, that was cause for hope. But I was pretty clear, as was Dr. Henry and Minister Dix, that although the light is at the end of the tunnel, we are not there yet. You can review the tape over and over again. We have not been popping champagne corks here. We have been giving hope to people that the hard work of British Columbians in communities and businesses across the province was paying dividends, but we needed to be vigilant. And the evidence is now in that we have not met that test. And I'm appealing again to all British Columbians to not blow this. Let's focus on getting through the next 3 weeks. This will be responding to an earlier question. If you don't need to travel, stay home. There's got to be something you can do at home that's as enjoyable as going somewhere else. Let's focus on the collective effort here, making sure that we are doing what we can as individual British Columbians to put COVID-19 behind us. And the only way we do that is focusing on living up to not just the spirit of Dr. Henry's orders, but the letter of those orders. That means reducing the size of the gatherings that we have, confining it to people that we know, and staying outdoors as much as possible. As the weather changes, that's going to be easier for people to do. We have wide open spaces for people to find recreation. We encourage that, but doing it in your family cluster is the way to go. There was a second one?
Yeah, I think we have recognized from the very beginning of our reopening that we have tried to find as much of a balance as we can, recognizing that this pandemic has differentially affected different parts of our community, whether it's the food and beverage industry, travel and tourism, we know are most affected. When we started our Restart program, we put in place COVID safety plans that were very specific to different businesses. And what we are seeing is the data does not show that we're seeing transmission in retail environments, in small retail, the small shops and stores that we have around the province. They are following their COVID safety plans, and those are working. We're not seeing transmission from personal service settings like hairdressers or barbers or nail salons. And again, it's because we know that people are taking those precautions. There are small numbers of people going in one at a time, making sure that we're wearing masks and taking the precautions that we need. Having said that, I talked about this last week, and we're doing it again. We're continuing to work on this. I established last October, November, when we started our second wave, a workplace task force, and we have been looking at what are the things in specific workplaces that make them more at risk, and how can we support businesses. And much of that now has been our outbreak responses, where we are using both shutting workplaces down, testing, and now immunization as part of our strategies to manage outbreaks, particularly in some of the very large workplaces where it's very difficult to continue to have the measures like safe distancing and personal protective equipment. We are also working with WorkSafe and to step up inspections in all sectors, and those will continue. And we are working on a protocol with Public Health and WorkSafe to make sure that WorkSafe inspectors are able to close down businesses when we see transmission in those settings, whether it's an office building, whether it's a car dealership, whether it's a retail store. So we have been taking more active measures to support businesses in safely staying open, but now's the time again to review your COVID safety plan to make sure that you're limiting the numbers of people, that you're having those meetings at home rather than or remotely as much as possible. And we will be working with WorkSafe to help enforce those in the coming weeks as well. So it is a multi-pronged approach, recognizing that we all need that balance, but controlling the virus is what allows us to get back to all of the workplaces and social activities that we need and want. And the quickest way to do that is by stopping the rapid spread that we're seeing right now.
Do you have a follow-up, Tanya?
Please, thanks. And Minister Dix, if we could get an answer in French as well, please. Can you further clarify what will happen now with the parallel Astrazeneca track? We know Surrey school staff have been told they'll now be receiving Pfizer instead. So will more doses from the age-based rollout go to frontline workers, or is that an exception and the intention is to pause the entire parallel rollout entirely?
Yeah, so because this signal arose over the last couple of days, we have pivoted the clinics that were planned for today and until we have more information. So we will be looking at how we use the AstraZeneca vaccine that's coming in. And yes, it may be that we'll put it towards the age-based program, knowing that this risk is not seen in people over age 55, at least not yet. But that's much to be determined. So we will know more in the coming days, and by later this week we'll have a better idea of how we can use that. It's one of those things, it's an early signal. We're just taking this action to pause until we understand more.
Thank you, Tanya. I just want to remind again, as did in the opening, that all British Columbians in all regions who were born in 1948 or earlier, that's age 73 or older, can now call and book their appointments across health authorities in BC. All people deemed clinically extremely vulnerable and who have received a patient invitation letter can call and book their appointments right now. There are some exceptions in smaller communities where we're taking an all-of-community approach because of the size of communities, particularly in the Northern Health Authority, but also in Interior Health and in Vancouver Island Health. But that's the situation now, and we encourage everyone to get their vaccination and to book their appointment who are eligible and on the list to book their appointment when their moment comes. It is, I think, something we can all do from one another, which is to book our appointment and to be safe. It makes everyone safer. Je dirais en français sur la question d'AstraZeneca qu'on va considérer l'évidence un peu partout dans le monde, mais ici au Canada aussi. On va travailler avec toutes les autres provinces du pays et avec la Santé Canada pour assurer que tout le monde est protégé aussi que c'est possible dans ce programme des vaccins. Donc, on va le faire pendant les 2 ou 3 jours à venir. Ça peut changer le programme. Et aujourd'hui, on a fait à Surrey, par exemple, on a décidé de maintenir l'horaire des vaccinations. Et donc, on a décidé de le faire aujourd'hui avec Pfizer, bien entendu, pour assurer que tous ceux qui ont reçu leur date aujourd'hui ont pu continuer. Mais cela étant, il faut, dans les jours à venir, faire ce qu'on fait chaque fois. C'est de suivre la science, suivre les conseils de la santé publique et assurer que notre programme d'Astrazeneca, qui va continuer en Colombie-Britannique, que ce programme est le bon programme pour tout le monde. Merci beaucoup. Thank you very much, and we'll see you later in the week.